don't see it in our smaller muscle models because they don't have a pelvis. But you can see the common iliac, external iliac, internal iliac, and then the obturator artery, but you can't see the other ones that we talked about on Tuesday. And then today, as we follow the arteries into the lower limb, we'll be able to see them a little bit better on this larger model, a brand new one. All right, so question 1 says the pancreas receives oxygenated blood via branches of which of the following vessels? And this is the pancreas right here. Okay, so I could make it a little bit larger. I didn't want to do it right at the beginning because it would cover up the words. Okay, so the question we had on the quiz with celiac shrunk is be oriented is right here. And this is the superior mesenteric artery here. I can talk about the pancreas, and then I'm asking you what the vessel is, that you can see the vessel type. So when we looked at the model previously, you can, here's the pancreas as well. That's another view of it, and what is seen behind the stomach. All right, question 2. You ready? Go over there, okay. And take a breath. When I get home tonight, the house is going to smell of cooked pears and apples. Because the daughter of the lady I stayed with went up to Apple Hill yesterday. It was like 2 weeks ago, she went turkey hunting. She got a whole bunch of old, from trees that used to be an orchard, but no longer kept that. And brought home about 20 pieces that she wanted to turn into a cobbler, but she never did. So after about 8 days, her mom made peach cobbler. So I came home last night and at about 11:45, and there was 3 boxes of apples and 2 big boxes of peaches. So her mom called in sick today so she could, she decided not to wait for 10 days before she put them up. All right, now are you done with question number 1? Okay. Question number 2, branches of the internal iliac artery supply which of the following organs or structures? artery passes through for the magnum, then that's where it joins. It becomes exactly inside, on the basal side.
I'm not sure, I'm just trying.
Oh, you are trying? Okay. We're trying to do. If you listen to your recordings from lecture on Tuesday night, I made a single sentence statement that answers this question. I said, I want you to know these vessels, but for lecture, I want you to recognize that, da-da-da-da-da-da. Do you remember every single sentence I say?
I tried.
I know. I try to. So, think of in your mind, if you look at your lecture notes or your textbook, of various branches of the internal iliac. And while I only typed certain ones that I want you to be able to identify for lab, I said I wanted you to recognize that certain organs were supplied by branches of them. Yeah.
Is one B?
One letter. We got three over here. Well, if you have three.
But they're not like identical to what we have right now.
If you have three letters though, there's only one choice.
That was our other.
I googled it, says the common hepatic artery supplies oxygenated blood to the liver, stomach, pancreas, and gallbladder.
Okay. So we move on. All right, we're gonna finish up with the lower limb. And then when we come back at the end of lecture tonight, we'll finish up with the lower limb as well. And we're gonna do the same vessels that we're gonna do right now with the addition of two superficial veins. Remember I said about 85% of the arteries have veins that travel with them by the same name. So we have those for the veins as well as a couple of superficial ones. So we have the we have the abdominal aorta dividing to form the common iliac. Right along the iliopectoral line where we separate true pelvis from false pelvis. And we finished up on Tuesday by talking about the branches of the internal iliac. And we labeled the rest of the external iliac, but I have no idea what number we called it. Anybody remember? Do you want to keep numbering in?
51.
51 was the last one?
51, yeah.
Okay. Or we start with 51.
We start with 51. 56 was our last one.
All right, so the external iliac is going to come to a band of collagen fibers known as the inguinal ligament. And the inguinal ligament creates a passageway for blood vessels and nerves between the abdomen, pelvis, and the lower extremity. So this is the inguinal ligament right here, all right? And as soon as the external iliac, which is traveling along here, passes under that, through that opening, it changes its name, similar to how subclavian changed its name to axillary, and external iliac becomes femoral. Okay? So it's just a change in landmark that it goes by. And so we're now going to, I'm going to just stick to the right side here. So we're going to have the femoral artery. It actually goes more vertical, but this gives me a little bit more room to work with here. And we'll make 51. Yes.
You said that the black line is
Let me label that for you.
Is it oxygenated? Because she thinks that way.
Inguinal ligament.
Good.
Okay. So 51 will be femoral artery or femoral, depending on how you want to pronounce it. the femoral arteries that supply the medial thigh and posterior thigh, because we have 3 compartments in the leg and only one major vessel passing through that. So the femoral artery becomes a place that's very important in paramedic first responder work, or anybody that's going to be somewhere you might be falling off a cliff and damaging, because that's still a large vessel, all right? And blood pressure there is pretty high. So if that gets cut, you're going to lose blood pretty quickly in arterial spurts. And so that becomes one of the pressure points, because the femoral artery is very close to the surface of the skin. And that's a triangle right in this inguinal area. Okay, so if there's any kind of cut farther down in the thigh, that's the area that it becomes important to supply pressure to. As it travels down the thigh, it's going to pass through the adductor magnus muscle and disappear. So I'm going to draw, well, I'm going to make it a little bit longer before it disappears. And I'll show that to you on the, I actually have a short femoral artery here just so I can have everything up on the board. And it disappears into the adductor magnus muscle and reappears behind the knee. And at that point, it's called the popliteal or popliteal artery. Popliteus or popliteal fossa is the space behind your knee, like cubital is your elbow. This is still new, so it's hard to pop off here. All right, so right here, this is the adductor magnus muscle. I don't know if you remember from 4:30, but it's the largest posterior. Even we see medial. So there's the popliteal artery showing right there, and it passes behind the knee, and then gives off its first branch as it ends to form anterior tibial and posterior tibial, which is going to continue to travel straight down the deep leg. So popliteal artery is going to end as soon as anterior tibial branches off. And the rest of what it looks like is continuous popliteal, actually our posterior tibial. So I'm going to draw what's behind the knee, continuing to draw that as a dotted line or posterior aspect. All right, and so 58 will be our popliteal artery. And I do want you to learn the branches off of them. There's usually 2 that branch above the knee and wrap around the knee joint, and 2 below. And these are called the genicular arteries. You had me for Bio 430 last semester. Do you remember what we call the bend in the mandible? The genu. The genu means to bend. So the genicular arteries go around the bend of the knee bends. All right, so these are the genicular arteries. And there's superior and inferior, you don't have to worry about specifics. 2A's is my abbreviation for the plural of artery. Let me give you a view. You can see a little bit here of the genicular arteries, but let me show you here. So here's the popliteal artery giving off the geniculars. Okay? Now the popliteal, once it gets behind the posterior tibial, behind the tibial bone, it's going to give off a lateral branch that passes through. There's a fibrous, I don't know if you remember the syndesmosis type of a joint, but there's a fibrous membrane here, and this passes through that to become on the anterior compartment of the leg. So as soon as that happens, popliteal artery no longer exists. So just to give us an idea where that is, I'm going to draw a solid line out here, and then we'll continue down with the posterior tibial. Okay? Let me do the posterior tibial, and then we'll come back to anterior tibial. So posterior tibial is going to be 60. And it's going to supply the posterior leg, where we have the gastrocnemius and soleus muscles, but we don't see it there because it's running along the flexor digitorum and all those muscles. And no, specific muscle and ask you what muscle supplies it, what blood supplies it, I'll ask you compartments. So posterior leg, or lateral leg, or anterior leg in that fashion, okay? So posterior tibial comes down here, and then along with the tendons of the deep muscles of the leg, it's gonna pass behind the medial malleolus and onto the bottom of the foot, okay? Anybody remember what we call that region for the bottom of the foot? Ventral surface of the hands or the palms. The bottom of the foot is identified as the plantar surface. Okay, so these vessels are plantar arteries. So we're looking at the bottom of the leg here. Posterior tibia is going to wrap around medially. And continuing to the bottom of the big toe, we have the medial plantar artery. And crossing over to the little toe, we have the lateral plantar artery. Okay, so this is on the bottom of the foot. So 61 is going to be medial plantar, and 62 is going to be lateral plantar. So if I say trace a drop of blood to the bottom of your big toe, you're going to need, because it's going to the bottom, you're going to need your posterior tibial artery, not your anterior. You're going to the bottom of the big toe, you're going to take the medial plantar, not the lateral plantar. It's going to go to your little toe. And 62 will be the lateral plantar artery. So if you're drawing these on yourself, a tickle, draw it on the bottom of your foot. So here's a view of the posterior tibial coming behind the medial malleolus, going to the big toe as the medial plantar, I'm crossing over to the little toe as the lateral plantar. Okay? Now one more branch comes off of the posterior tibial, and that does the lateral compartment of the leg, the one that rolls the outside of your foot up. And this is also a lateral branch, all right, but I'm going to draw it as a dotted line because it doesn't come to the front of the lower limb, and that will be 63, and that's fibular. The fibula is the lateral bone, so the fibular artery, the old-fashioned name is peroneal, but fibular artery goes to the lateral compartment. We go back up to that slide that showed the knee. Here was the anterior tibial coming off, and that's where popliteal stopped. It became anterior tibial and posterior tibial, and here's the fibular. Okay? So if you look at this model, it's not very clear, so I don't use it very often for quizzes, but here's two lateral branches. Here's the fibula. That very first lateral branch is going to be for the anterior tibial, and then the second lateral branch is for the fibula. All right, I'm going to take this segment here and draw it a little bit larger over here, because drawing the anterior tibial on top of that just tends to make it even more confusing. So again, we're going to have popliteal, and it's going to continue as the posterior tibial, okay? Anterior tibial comes off, passes between the tibia and the fibula, passes to the front of the leg, and travels deep to the muscles of the anterior compartment of the leg. Also crosses over to the medial malleolus, but stays above it, and then curves around onto the top of the foot. So we have 64 for anterior tibial artery. And as it crosses the ankle, so as it gets past the medial malleolus, we now call it the dorsalis pedis. Remember, the top of the foot is dorsal to the bottom of the foot. We don't say superior because it's a horizontal structure. So the dorsal surface, or the top surface of the foot, dorsalis, and pedis is our word for foot. So if someone has a cast placed on their leg and you have access to the top of the foot, so it doesn't go all the way to the toes. It should be checked, the dorsalis pedis pulse, the pedal pulse should be checked to make sure that the cast is not too tight. All right, you can always check the color of the toes, make sure they're feeling warm. And it's a little difficult to find that artery there because it's not a large one and it's a distance from about as far from the heart as you can get, okay? You might want to see if you can find it this weekend. While you're home, we do have a lab to find different pulses, but try to find your femoral pulse in other places might not be something you want to do and go look. So there would be that anterior tibial artery, and then if it gets onto the foot itself, this is the dorsalis pedis. It's called the arcuate artery as it passes across the base of the toes, but we're not going to worry about that. We're going to stop with dorsalis pedis. Okay. Okay, so question number 3. All of the following are supplied by the posterior tibial artery or its branches, except for one letter answer. I just said, all of the following are supplied by the popliteal artery or its branches, that would be true. That does everything. It does the side of the leg, the bottom, back of the leg, the bottom, the top of the foot. But we're past that, so we're looking for one decimal or its branches are going to do everything but one of those regions. May I erase the board while you're studying this? So you don't need more contact information.
Top of the foot.
I think it's a little too cold now to go lay out by the pool in your swimming suits and draw blood vessels all over you. You had chances last weekend. Yeah.
63.
So my son is by himself in Denver because my husband's traveling, and it was
So where was the
79 degrees on
posterior
Tuesday and 20
tibial
by
artery get to the
Wednesday.
top of the foot?
So I called my husband, I said, we'll know how to turn on the gas furnace,
Posterior.
because it's
Posterior
the house was
tibial,
built in
that's on the left.
1929, and our furnace was coal, but was converted to gas,
what?
but it's still the
There's no
original
lateral.
furnace in the house. I would have no idea what to do with it, because it has steam radiators and all that.
What do you mean?
So,
All right, so now we're ready to look at veins. And one of the first things to realize is that veins are past the capillaries. Everything, as soon as you leave the heart, you're on your way back to the heart, okay? But the veins are returning to the heart from the capillaries, so they're under low pressure. And as we talked about with histology, that's going to change the thickness of their wall, right? We need the presence of valves. And so as we draw those,
Tibial artery supplies
so I'm
blood
going to
to
do
all
it
of
in
these
segments, but I'm going to be drawing the vessels going back to. So we change our terminology from blood is moving from, or which of the following is a branch of, to blood is moving to blood is moving from,
But what if
all
they're
is
breaking
going
off of it?
together to form. So we said that the branches of out trunk have two branches, the subclavian and the common carotid, all right? Now that we're talking about veins, is what two veins join together to form instead of branching, because blood flow is coming in together, and vessels are coming together to form a fewer number. So we're gonna start with the sinuses. This is just kind of a diagram of it. You probably covered dural sinuses last, in file 430 with the brain, so this should be a review. And we have a couple of models here of the dural sinuses, one the flippy floppy one. But I'm not so much concerned about the dura itself as the channel. So this is not a true blood vessel. It doesn't have an epithelial lining. It doesn't have muscle, all right? It's just a gap. in the connective tissue of the dura, through which pressure gradient moves not just veins, venous blood from the cerebral veins. So our anterior cerebral veins and middle cerebral veins are going to empty their blood into these sinuses. Plus we have cerebral spinal fluid, which actually came from capillary fluid and arteries. So all of that is being returned to the heart. Okay? So if you're not quite sure what the structures are that I'm diagramming, I have the dura mater patterns up there. We have it here with the falx cerebri and the tentorium cerebelli. Okay? And we have this model where the similar structures are shown in a more rigid fashion. So we'll look, and we're going to switch our color to blue. Again, venous blood is not blue. All right, it's a dark red, just looks blue when we look at it through the skin. So let me switch the diagram to this image. So this one is showing both external veins and the deep veins. All right, so I'll draw that aspect. And I'm going to start all over again with number 1, okay? As far as the numbers of structures. So across the top of over the brain, over the space that would be the longitudinal fissure, we have the superior sagittal sinus. And the pressure flow is in this direction. In the inferior edge of the falx cerebri, we have a smaller, more irregular one that's kind of in the same location as the anterior cerebral artery. We would have an anterior cerebral vein there that would be draining into this structure. And then the two are joined here. So 2 is going to be the inferior sagittal sinus, and 3 will be the straight sinus. The straight sinus joins with the fluid coming from the superior sagittal sinus to form the confluence of sinuses. In our chart, that would be right here. Okay? And here's the inferior, straight, superior, and confluence. Then, those are all single structures, and now there's a choice. The fluid can flow to the right or to the left via the transverse sinuses. And this is flowing along the actual skull. So when you look in a real skull, there's actually grooves, channels, where the softer bone tissue hardened around the presence of these sinuses. So these would be the right and left transverse sinuses. And then right near the temporal bone, they end by forming this double S-shaped curvature. Now there are other sinuses towards the front of the skull, cavernous sinuses and petrosal sinuses that we're not dealing with, okay? Just so when you think these are the only sinuses in the skull. And this has that S-shaped curve. So the sigmoid sinus, a pair of those. So we're right here. And the sigmoid sinus ends at the jugular foramen. Gap between the temporal bone and the occipital bone. And now our combined cerebrospinal fluid and venous blood actually enters the true vessel. And this is the origin of the internal jugular vein. common jugular, right, with the arteries. When we had a common carotid, we had an internal and external. We had a common iliac, we had an internal and external. We have no common jugular. This is our internal jugular. And it takes the place, we don't have any carotid veins, period, okay? So this takes the place of the internal carotid artery as far as returning fluid. And we do have vertebral veins, all right, which we'll draw in just a moment. And interesting, we completely separated the blood supply to outside the skull from the blood supply to inside the skull between our internal and external carotids. It's more mixed up when we look at the internal and external jugulars. So here's the internal jugular, and you'll see that it's also receiving blood from the facial vein, which is external. So most of the blood from the surface of the face is coming from the vein structure of the face. It's going to flow into the internal jugular vein, even though the facial vein itself is supplying the external structure of the head. So 8 is going to be facial vein. Sorry, 7. I go to 7 up yet. And 8 is facial.
Can you say that again, most of the
Uh-huh. So with the arteries, we kept it separate.
Yeah.
External carotid artery and its branches went outside the skull. Internal carotid and its branches went into the skull, okay? Here we blend them together. So the internal jugular is carrying the blood from inside the skull back towards the heart, but it also is picking up blood from outside the skull from the facial vein, okay? Not only that, but our superficial temporal and our maxillary can either go into external or go into internal through this connecting component here. All right? So before I go any further, because it's going to be a little confusing to draw this on top of what I have for the dural sinuses. So I'm going to essentially just erase what I have for the dural sinuses and start here. Okay, so we can look at the external drainage. Okay. So since you can erase as easily as I can, if you want to redraw this region right there, because I'm going to add the superficial temporal and occipital maxillary components to it. So external is slightly lateral to internal, and it's much smaller. We're going to receive, external is going to receive the occipital vein. I'm going to put the numbers on here in just a second. Superficial temporal here. And if you read different places, it'll say different things as far as what it drains into. But in the diagram we're using here, superficial temporal drains into internal jugular. But then there's a connection between the internal jugular and the external jugular via the facial vein. It's hard to see this, or impossible to see this on our skull model, on any of our models, because it happens behind the mandible, and that's its name. The name of its vessel is the retromandibular. Okay, so let's put in some numbers here. And we're ready for 9. 9 is going to be, up here, superficial temporal vein. 10 will be maxillary. region will be occipital. And these all drain, or have a possibility of draining into 12, which is the external jugular. And then 13 is a retromandibular that forms this connection between external and internal jugular via the facial. That would be this one right here. Retromandibular, behind the mandible. So draining the side of the outside of the skull, the scalp and the muscles up on the side of the skull, we have superficial temporal. Draining into external jugular. We have occipital draining into external jugular and maxillary. And these two up here, superficial temporal and maxillary, could go into facial and then into internal jugular, so they have that variability, okay? I neglected to mention when I drew the facial up there that the veins, this is called the danger triangle around the nose, because the veins in this region are connected to veins that pass back to the brain via the nasal cavity, and those don't have any valves. So if you pop a pimple or a boil in that area, with the pressure to do so, it's possible to push bacteria back into the brain. Because of the pressure of popping that can push the bacteria across the capillary walls, and there's no vein, there's no valves to keep the backflow. If that pressure is possible, push it. It doesn't happen very often, but it's a possibility. Okay, so that's why it's called the danger triangle. All right, then we have draining from the basilar vein. We have the vertebral vein in the same openings along the cervical vertebra as we have the vertebral arteries. Yes?
Just making sure, number 9 is pointing to the V shape.
It's, yeah, we have multiple superficial temporal veins like we did for the arteries. You're correct. And we can see those also on the head model. So here we have superficial veins. And the external jugular can be easily defined because it's always superficial to the sternocleidomastoid muscle. The internal jugular is down in here. I wouldn't tag it there. You just can see a little piece of it. And retromandibular is going to be behind the mandible. So we can see superficial temporal vein. We can see occipital vein. You can see, although both of those coming into the external jugular. Right? So as long as this vein is between the skin and the sternocleidomastoid, it's going to be the external jugular and not the internal. And the internal is much larger anyway. All right, so I want to erase the board. Our last number was 13. No, yeah, 13. And I'm going to redraw this region that we have so that we can see how these combine together to go form the superior vena cava and return this leg to the heart. Okay. I could do it down there in the bottom of the screen, but it'd be kind of cramped. Do we have that down? Did I number the external jugular yet? Did I give it a number? 12. Yeah. 12, okay. So here is the superior vena cava. And it's formed by the union of the brachiocephalic, and I'll come back in and number these for you. So the right brachiocephalic vein is much shorter than the left because it doesn't have as far to go. It's coming into the right atrium of the heart. So the right atrium of the heart is closer to the right side than it is to the left side. Okay? So this is going to have to extend a little bit farther out here. Now, not ready to number those yet, but here's where the internal jugular comes in. And it's going going to join the subclavian to form the brachiocephalic. So what was our number for internal jugular? 7. Okay, so I'll just remind us. That's internal jugular, and external jugular was 12. So external jugular does not join with the internal jugular at all. It's going to drain into the subclavian. 13 was retromandibular, so we're going to put 14 as vertebral. And 14 comes into subclavian between the internal and external jugular, the external and internal jugulars, and kind of from the back, and drains into subclavian. So this will be 14. The vertebral vein, 14. 7 is internal jugular, so we'll make 8, not 8, right, 15. The subclavian. So the subclavian vein joins the brachiocephalic vein to form, subclavian vein joins the internal jugular vein to form the brachiocephalic vein. Okay, because we're going towards the heart, so we don't use the term branches. So 16 will be brachiocephalic. We have 2 of those in this diagram. Remember, we only had 1 brachiocephalic artery or trunk, but we have 2 of the veins. And then the 2 brachiocephalic veins join together to form the superior vena cava. So those are lecture type questions. Which of the following veins join together to form the portal vein or the brachiocephalic vein or the superior vena cava or the inferior vena cava? Okay. So here's internal jugular joining with subclavian to form brachiocephalic. External jugular drains into subclavian, and vertebral drains into subclavian as well. Okay. All right, so now we're going to look at the veins that carry blood up from the upper extremity and form the subclavian. And we have our first superficial veins that we're going to name here. We'll do the upper limb and then we'll take a break. Okay? So we're not going to do the fingers, all right? We're going to do the deep veins first, and then we'll look at the pattern of superficial veins. The deep veins follow along the same exact sequence and pathways that we have with the arteries. So our lateral vein in the forearm is the radial vein. And the medial vein is the ulnar vein. And those join together to form the brachiocephalic. And brachiocephalic becomes axillary, and that becomes subclavian. So in sequence, we're going to drop down here. So we have radial and ulnar. They flow together and join to form the brachial. Remember I said the brachial artery is the one that we listen for as we're using a stethoscope to determine blood pressure? Why don't we use the vein? Too low. It's not going to create any turbulence that we can hear with the stethoscope or be able to palpate. All right, yeah. I had this. up in here, we'll put axillary. And we're gonna use some slightly different parameters for when we determine the beginning and the end of axillary, okay? So we had arteries by all of these names, and we find the radial artery with the radial vein, and the brachial artery with the brachial vein, and so on. So radial artery, radial vein and ulnar vein join together to form brachial vein. Brachial vein becomes the axillary vein. Axillary vein becomes the subclavian vein. Then the subclavian vein joins with the internal jugular to become the brachiocephalic. Okay? Now, as you can see when you look at yourself, we have superficial veins that are found in the skin. We don't have arteries there because it's too dangerous to tear the skin and cut an artery, all right? But we do have superficial veins. They vary greatly. Many times they don't have a name. We just call them communicating veins or venous communicantes, but some of them are named, all right? But it's highly variable. So I'm gonna give you two different patterns for the return of the superficial vessels, and the blood will eventually move into the axillary. One is called an H pattern and one is called a Y pattern, okay? And both of these, I've seen it on the same person. I had a student a few years ago. One arm was H pattern, the other arm was the Y pattern. I wish I'd taken a picture, because usually you don't even see them because she was very thin and they were visible on her. So on the back of my hand, at the base of my knuckles, you can see an arch of a vein going across my hand. I probably have less collagen and elastic there than you do, so it's easier to see them. But this starts across the base from little finger to thumb, arches across that as the dorsal venous arch, then comes up my radial, stay out to my forearm, and then travels a little bit more onto my anterior forearm, and then it's going to disappear right about here as it heads for the axillary artery, okay? So I'm going to end up with a very wide wrist here, just to keep things clear. And then over here, I'm going to draw the H pattern here, and over here I'll draw the Y pattern. And the H and the Y show how these two major superficial veins are connected around the elbow. That's the main difference. So starting at the dorsal venous arch, across the back of the hand, remember dorsal is the back, we have this superficial vessel that comes all the way up and empties into the axillary just before it becomes subclavian, okay? So dorsal venous arch becomes the cephalic vein. The cephalic vein travels up the lateral aspect of your upper limb and enters into subclavian just prior to becoming subclavian. So it actually drains into the axillary. So 22 will be dorsal venous arch, and 23 will be cephalic vein. That's the lateral aspect. And in fact, if we look at this large torso in the back of the room, what I call the brown torso, actually a reddish brown. Let me move this. That'll allow you to stand in here. So see this large vein right here? Between the deltoid muscle and the pectoralis major muscle. This is a superficial vein. This is not the axillary vein. That would be found in the armpit. Okay? So it's coming up here on the lateral aspect of the arm, and then it's disappearing through this muscle to get into this axillary just before axillary becomes subclavian. So axillary, if it was shown, and it is right under there, okay, it's in the armpit, that's what axilla is, and this would be the superficial cephalic. Okay? Then on the medial aspect aspect, we basically start at the wrist, not on the back of the hand. And this is the basilic vein. So it's gonna come up here along the ulnar vein, but in the skin. And it's gonna travel and get into the axillary, just at the end of brachial. So right at the point, brachial stops right here and becomes axillary, and basilic drains into it right after that point. So both basilic and axillary are emptying into the proximal and distal ends of axillary vein respectively. So 24. Is the basilic vein. Now we have basilar artery, okay, this is basilic. For some reason, I've never been able to figure out, I was typing it today. No matter what computer I type it on, if I type basilic, it always adds an A and makes it basilica. Is there a typo there? And I have to backspace and delete it. Yeah, there's no A, it's just basilic. All right, so that's, we're not quite done with the H pattern yet, but those are the two major superficial veins. To make the H, blood that's draining from the cephalic vein can cross over to the basilic vein, right at the area of the elbow. And this is called the median cubital. Cubital is our cubital fossa, like popliteal, but it's the space behind the knee. So 25. Median means the midline. 25 will be median cubital vein. Okay? That's the crossbar of the H. Then we have another vein that runs up the midline of our forearm, called the median antebrachial. Brachial is arm, antebrachial is forearm, if you recall from way back learning regions in file 430. And that's usually shown draining into the basilic, but it can also drain directly into the median cubital. So I'm gonna draw it like this. But it can also just go straight up. So this would be the median antebrachial. Confusing with all the green and the blue on top. So let me redraw those behind the screen and compare for the H pattern and the Y pattern. And we'll just do the superficial vessel. With the H pattern, this is the right. So this is going to be and replace it with a median basilic and a median cephalic. And that's how we get our Y. We still have the cephalic. So this would be cephalic. So no median cubital. And then this is our median antebrachial. So with the wire model, the flat green model tends to show the H pattern, but our wire model actually, I like the old one better. They're all fused together in this newer one. So here are the veins. So we have the ulnar artery and radial artery and brachial and axillary and subclavian arteries. Here we have look at the back. We have the radial and ulnar and brachial and axillary and subclavian as well. Superficially is placed in front. So here would be the cephalic going all the way up to axillary, just before it becomes subclavian. Here would be the basilic, doing the same thing, emptying into axillary, a bit more distal. And then this is the Y pattern. So here we have the median antebrachial with the median cephalic and the median basilic. Okay. So it's just a couple of variations. I used to not talk about them, but then the models were different, and students were getting confused why they look differently, and that's why. Okay, so let's take a break. When we come back, we'll look at the drainage of the chest into the superior vena cava, because we have no homologous structure to the thoracic aorta. So everything from the chest has to go into the superior vena cava, and then everything below the diaphragm comes up through the inferior vena cava. Okay? So why don't you come back at 5 after, and I'll be good on the board.